Namaskar. Welcome to my YouTube channel. Today we are going to discuss about midwifery and gynecological related question answer. Part 1. Let's start. The first question: which vessels are found in the umbilical cord? Option A, 2 veins and 1 artery. Option B, 1 vein and 2 arteries. Option C, 1 vein and 1 artery. Option D, 2 veins and 2 arteries. The correct option is option B, 1 vein and 2 arteries. In the umbilical cord, there is 1 vein called the umbilical vein and 2 arteries called the umbilical arteries. The umbilical vein carries oxygenated blood from the placenta to the fetus, while the umbilical artery carried deoxygenated blood from the fetus to the placenta. This arrangement allows for the exchange of nutrients and waste products between the mother and the fetus. Which stage of labor involves the full dilation of the cervix and the delivery of the baby? Option A, first stage. Option B, second stage. Option C, third stage. Option D, latent phase. The correct option is option B, second stage. The second stage of labor begins once the cervix is fully dilated 10 cm and continues until the baby is delivered. This stage involves intense contractions, enabling the mother to push and guide the baby down the birth canal. What is amenorrhea? Option A, absence of monthly menstrual bleeding. Option B, frequent urination. Option C, softening of the cervix. Option D, bleeding twice in one cycle of menstruation. The correct option is option A, absence of monthly menstrual bleeding. Parity is defined as option A, the strength of the uterine muscle. Option B, the dilation of the cervix. Option C, the number of time a woman has been pregnant. Option D, the number of women has given birth. The correct option is option D, the number of a woman has given birth. Gravida or gravidity. The total number of times a woman has been pregnant regardless of the outcome, miscarriage, stillbirth or live birth. Para or parity. The number of pregnancies that have reached a variable gestation age, typically after 20 weeks, whether they resulted in a live birth or a stillbirth. Multigravida. A woman who has been pregnant 2 or more times. Multipara. A woman who has given birth to an offspring, live or stillborn, after 20 weeks gestation. Excessive vomiting in early pregnancy is known as option A, hyperemesis gravidum HG, option B, morning sickness, option C, normal in most pregnancies, option D, hypervomitus. The correct option is option A, hyperemesis gravidum HG. A uterine contraction is option A, sometimes referred to as Braxton Hicks. Option B, a tightening and shortening of the uterine muscle. Option C, a signal to the midwife to perform an artificial rupture of membrane. Option D, the stretching of the pelvic floor muscle. Option E, both option A and B. The correct option is option E, both option A and B. Uterine contractions are the rhythmic tightening and relaxing of the uterus muscle, essential for childbirth to push the baby out, but they also occur during menstruation, orgasm, and pregnancy. For different psychological reasons like menstruation, arousal, or practice for labor, they involve the uterine muscles hardening and softening, with true labor contraction becoming stronger, longer, and more frequent, helping to dilate the cervix. Braxton Hicks contraction, also known as false labor pain, are contraction of the uterus that typically are not felt until the second or third trimester of the pregnancy. Braxton Hicks contraction are the body's way of preparing for true labor, but they do not indicate the labor has begun. LNMP stands for option A, labor not making progress, option B, legal natural mother's parity, option C, last normal menstruation period, option D, none of the above. The correct option is option C, last normal menstruation period. LNMP is commonly used in medical and obstetric contexts to refer to the date of a woman's last menstruation period. It is an important piece of information for calculating the estimated due date of a pregnancy and for monitoring the progress of the pregnancy. By knowing the LNMP, healthcare professions can determine the gestation age of the fetus and track its development. What is the lining of the uterus called during pregnancy? Option A, decidua. Option B, endometrium. Option C, basal. Option D, none of the above. The correct option is option A, decidua. During pregnancy, the lining of the uterus undergoes changes and it's called decidua. The decidua play a crucial role in supporting the developing fetus by providing nutrition and oxygen. It also helps in the attachment of the placenta to the uterine wall and act as a protective barrier for the growing embryo. The decidua is shed during childbirth and is replaced by a new lining of the postpartum period. The endometrium refers to the inner lining of the uterus. Basal layer is the deepest layer of the endometrium, sitting against the uterine muscle and providing the foundation of regenerated the functional layer that sheds during menstruation, making it permanent and crucial for endometrium repair. Most common site of ectopic pregnancy. Option A, cervix. Option B, ovary. Option C, fallopian tube. Option D, abdominal cavity. The correct option is option C, fallopian tube. An ectopic pregnancy occurs when a fertilized egg implants outside the uterus, usually in the fallopian tube, preventing normal development and posing a life-threatening risk to the mother due to potential rupture and severe bleeding. APGAR score is assessed at option A, birth only. Option B, 1 and 5 minutes after birth. Option C, 10 minutes after birth. Option D, 1 hour after birth. The correct option is option B, 1 and 5 minutes after birth. APGR score is a quick test given to newborns at 1 and 5 minutes after birth, assessing 5 key signs: appearance, color, pulse, heart rate, grooms, reflex irritability, activity, muscle tone, and respiration, breathing, to check for immediate health issue and determine if extra care is needed. What is the normal fetal heart rate? Option A, 60 to 100 bpm. Option B, 100 to 120 bpm. Option C, 120 to 160 bpm. Option D, 160 to 200 bpm. The correct option is option C, 120 to 160 bpm. Which hormone causes the maturation of an immature graphene follicle? Option A, estrogen. Option B, FSH. Option C, LH. Option D, T4. The correct option is option B, FSH. FSH, follicle stimulating hormone, is responsible for the maturation of an immature graphene follicle. FSH is released by the pituitary gland and acts on the ovaries to stimulate the growth and development of the follicles. As the follicle matures, it produces estrogen, which further stimulates the development of the uterine lining. LH, luteinizing hormone, it is responsible for triggering ovulation and release of the mature egg from the graphene follicle. Montgomery tubercles are associated with option A, pregnancy. Option B, cancer. Option C, puberty. Option D, none of the above. The correct option is option A, pregnancy. Montgomery tubercles are small, normal bumps on the areola, the dark skin around the nipple, that are actually oil-producing glands that lubricate, moisturize, and protect the nipple, especially during pregnancy and breastfeeding, by releasing protective, scented secretion that helps guide babies to latch. The Papa-Nicolau pap smear is used for detecting option A, breast cancer. Option B, cervical cancer. Option C, endometrial cancer. Option D, ovarian cancer. The correct option is option B, cervical cancer. Pap smear is a vital screening for cervical cancer, where cells are collected from the cervix to check for abnormalities or HPV, human papillomavirus, that could lead to cancer. What is the normal duration of pregnancy? Option A 36 weeks, option B 38 weeks, option C 40 weeks, option D 42 weeks. The correct option is option C 40 weeks. What information would you gather and document when obtaining the obstetric history from a woman during her first antenatal visit, considering her past pregnancies? Option A, number of previous pregnancies, gravida. Option B, number of previous live births, para. Option C, number of previous miscarriages. Option D, all of the above. The correct option is option D, all of the above. Which two terms describe the position of the uterus? Option A, anteverted and antiflexed. Option B, fully fixed and anteverted. Option C, antiflexed and fully verted. Option D, none of the above. The correct option is option A, anteverted and antiflexed. The term anteverted refers to the position of the uterus where the uterus is tilted forward toward the bladder. The term antiflexed refers to the position of the uterus where the uterus is bent or flexed forward at the cervix. These terms describe the position and flex of the uterus in relation to its normal anatomical position. Most common benign tumor of the uterus. Option A, polyp. Option B, endometrioma. Option C, fibroid. Option D, adenomyosis. The correct option is option C, fibroid. Which hormone is primarily responsible for maintaining pregnancy? Option A, progesterone. Option B, estrogen. Option C, oxytocin. Option D, prolactin. The correct option is option A, progesterone. By how much does the body cells need for oxygen increase in pregnancy? Option A 20%, option B 40%, option C 50%, option D 60%. The correct option is option A 20%. Thank you for watching. Please like and subscribe.